Live interactive telemedicine is most like a regular on-site patient visit. The patient and the clinician can see and talk directly to each other with the use of video cameras and monitors. Live interactive telemedicine is appropriate when the clinician needs to talk with the patient or when the clinician needs to observe motion or other characteristics of the patient. Live interactive telemedicine is commonly used for providing outpatient medical specialty services as well as for intensive care unit support and emergency department consultations. Live interactive telemedicine can be used for almost any specialty. The most commonly provided specialties are psychiatry, neurology, dermatology, otolaryngology, more commonly known as ear, nose, and throat, orthopedics, endocrinology, urology, and rheumatology. Telemedicine visits usually have a variety of clinic staff involved in the visit. The provider site, sometimes called the presenting site or hub site, has clinicians, telemedicine coordinators, and technical support staff. The patient site, sometimes called the spoke site, has the patient, a telemedicine coordinator who assures smooth operation of the clinic, technical support staff who addresses any equipment or telecommunications problems, and a patient presenter who works with the clinician to examine and see the patient. Before beginning a telemedicine visit, patients should be given verbal and written information explaining telemedicine and how the visit will work. Some states require verbal or written consent for telemedicine services. It is important to know your state and program requirements. The patient will be given information on the benefits and consequences of telemedicine and informed that they can change their consent to use telemedicine at any time, that information from the visit is available to them, and that any information from the visit cannot be used by others without their consent. The presenter or the clinician will explain how patient confidentiality is protected during the telemedicine visit and will assure the patient that anyone at the remote site will be identified and introduced. Sometimes other clinical staff wish to observe a telemedicine visit. Patients should always be asked to approve before guests are allowed to observe a clinical visit. Most telemedicine visits utilize a patient presenter to assist the specialist during the patient visit. Depending on the type of visit, the presenter may be a medical assistant, a nurse, or a mid-level practitioner. Some visits, such as psychiatric sessions, may require very little assistance from the presenter. Other times, a physician will be present for part of the examination to perform certain physical examinations or talk with the remote clinician. The coordinator or patient presenter will explain the visit to the patient. Giving the patient the basics of video etiquette is most helpful. The patient presenter will also introduce the patient to the doctor.
Hi Karen, how are you today?
I'm okay.
I'm Dr. DiMatterio from Internal Medicine, and I'm going
The specialist can easily talk with the patient and can see the patient clearly from the remote site. Cameras usually have zoom lenses that allow the clinician to obtain close-up views of the patient when necessary. The patient can see the doctor at the remote site on the video monitor at the patient site. During a telemedicine visit, examination scopes specially adapted for use with telemedicine may be used to help the provider examine the patient.
We're just going to listen to your heart, so just relax.
For example, stethoscopes are used to hear heart and lung sounds. Otoscopes are used to see inside the ear, nose, or mouth. And general use cameras can be used to magnify skin lesions. Once the specialist has examined the patient, he or she will discuss the visit with the patient and provide follow-up orders or recommendations to the patient's site.
I will be writing the order and faxing it to your nurse directly after this appointment.
The site coordinator will usually follow up on these orders, placing notes in the patient chart and scheduling any follow-up appointments.
Oh, that sounds good. I don't have to drive 150 miles.
Most patients are very satisfied with their telemedicine visits and are especially happy to be seen in their local community, saving hours of travel to see specialists often located hundreds of miles from their homes.